and welcome to CIO News. I am Afreen Khan, your host for the broadcast and Head of Operations at CIO News. This is our exclusive fireside chat powered by GoTo, specifically for healthcare industry. This is a recorded session and will be available on our website, cionews.co.in, and our CIO News LinkedIn handle. I'm very excited to invite my guest today, Mr. Shuvankar Pramanick, who is the Senior Director Information Technology and Deputy CIO at Manipal Healthcare. Mr. Pramanick has been holding strategic role and leadership positions from the last 15 years. He has strategized different digital transformations in healthcare vertical by introducing technology like artificial intelligence and process automation by using bots, RPA, and machine learning. He has been doing collaboration between post-care with IoT devices. We welcome you, Mr. Pramanick.
Thank you. Thank you. Good morning. Good morning, all.
You're welcome, sir. We also have Ms. Natasha Rock from GoTo. She is the remote support group lead for the APAC region at GoTo. Natasha incorporates her 14 plus years of IT, sales, customer service, and technical experience to bridge the gap between a customer problem and a product offering. As a product specialist for the remote support group suite, she plays the voice of the customer internally at GoTo and the face of remote support products for their customers. Her unique insight into IT consumer trends, knowledge of the APAC geography, and passion for technology guarantees an interesting conversation. Welcome, Natasha.
Thank you, Afreen. Pleasure to be here. Thanks for having me.
Great. So, to begin the session, Ms. Pramanik, my first question would go to you. We all know that COVID changed a lot in our lives from all aspects. So, just wanted to understand what does your typical role in the organization look like working in the post-COVID era?
Oh, that's a great question, and I think we already recovered from COVID era, but the business is there, whatever we have established in the COVID era. So, the COVID has two positive things from IT perspective. One is like your new business domain, yeah, business area they have opened up, and second is your cybersecurity and technology revamped, in particularly healthcare industry. Typically, before COVID, healthcare industry was kind of on-prem solutions, on-prem provider in terms of technology sides, and after that it became totally on cloud-based and totally on remote-based service area, where IT is well aligned last 2 years during this COVID. So typically now business is have in particular healthcare, they have two kind of customer per se, yeah, two kind of patients who are taking service from healthcare industry. One is like your who are coming for their consultations, their diseases at on-prem basis, and there are certain customer who are not able to come in the hospitals, particularly senior citizens, and they need continuous monitoring systems, healthcare monitoring systems. So COVID has given them kind of extended them that kind of help by using technology. Yeah, telemedicines, teleradiology already there before COVID, but it has this application has scaled up a lot after COVID during the last year of the COVID, and these are the basic things what healthcare industry has followed, uh, and more of all sensor-based technology and post-care. It has revamped last 1 year. So technology sides, it has a great positive side from COVID.
Great, great. So I think there have been a lot of changes when it comes to the technology piece also. More of it going on cloud rather than the traditional setups, and the versatility that was required from the technology side, I think that has been explored to greater lengths during the post-COVID era. So
Yeah.
the same question to you, Natasha, considering your role, you're as it is a remote support group lead. So for you, it is more imperative
Yeah.
to kind of support people remotely. So what does your typical role look like working in the post-COVID era?
Yeah, well, just a little bit of our history, right? GoTo has been supporting remote working from the last 20 years, since 2003, in fact, right? So it's something that definitely wasn't new for us, but in a lot of ways it was new, right? Because the whole shift to that whole virtual working, hybrid working, remote working message that we were putting out into the market for those like 18 years prior to the pandemic, it became all the more stronger in those 2 years during the pandemic, right? The usage on our products grew 1,000%, right? And so we were getting companies from across the world, across industries, healthcare, pharma, education, industries that were not very tech heavy in the past. They were adopting technologies, rightfully, like what Shuvankar said, right? And so and we got to be a part of that journey with them because our products, our solutions became essential. It's rather than good to have, a nice only companies looking at buying, adopting high advanced technology. This it became a necessary for SMBs, for small scale companies, for companies across different industries, and so we realized that enterprise companies across industries they were looking to differentiate their CSAT. They were looking to differentiate their SLAs to XLAs and all of that. But for SMBs and for smaller scale companies, it became a question of survival, right? Of keeping their lights on, and they needed technology to do that. And GoTo's solutions, which is from remote support and from collaboration, became essential connections. And we were very, we were, it's been a pleasure to have been part of that journey, and we have retained those relationships as we've gone ahead, and as we've moved beyond the post-pandemic era now, and we continue to remain essential as well as part of that journey.
Yes, absolutely. I think all of the integration of all of these technology solutions is the key to kind of how to work remotely as well. So very true there. My next question to you, Mr. Pramanik, we understand that people are now working distributedly, and it has become very necessary to kind of scale up and arm the IT teams with the right tools. Now, what have been the demands of your IT ecosystem on this front?
You mean to say kind of remote working, particularly?
Yes, particularly remote working, or even like you mentioned that the telemedicine piece, or
Yeah,
any
yeah,
implementation that the healthcare industry brought into effect because of COVID, and how it has changed. So how has it become very important, and what have been the demands of your type of an IT ecosystem on that front?
yeah, yeah. It's very high demand as of now. Since in our industry, the user is the consumer for remote working. It's not the employee. In many industry, in IT industry, in the COVID era, employee was the user for remote technology. But in healthcare industry, it's patient is the or consumer is the user of the remote technology mainly. So, in healthcare industry, what extra things we considered? Yeah, we feel that technology should have more. In healthcare industry, always patients have some psychological dependency on their consultant, on their doctors, right? When they are coming to the doctors, so when they are adopting in through the technology the same service, so you need to be like kind of create the environment where patient should not feel that it's the treatment whatever is going through using this technology is not the appropriate. So that is a psychological barrier and psychological challenge what technology have taken. And I can give you a simple example. So when you are coming to a hospitals, uh, you are waiting for the consultant outside the consultant room, sitting in a chair. Your number will come up. Your queuing is there. After that, you go into the consultant room. The treatment has been done. The prescription has been given to you, and it came out from the room. If this is the cycle, it's a simple cycle. If I have given the examples, if I take it through technology, through a remote technology, you have to create some waiting room kind of environment. You have to give them a kind of knowledge transfer on that time. Suppose your consultations will be done in particular time, or you are, in general, what we have seen in senior citizens, people, they logged in the systems much before that time because they are very cautious on timing per se. So when they are coming into the room, they should feel that they are waiting for the consultant, and consultant will come. Their conversation should be in proper manner. So where the technology will give you the seamless feel factor to the consumer. So this is a simple example. So these are the biggest challenge when this COVID started, but now it is very matured systems we have. And uh, when different this Paytm and GPay would have come in the market, we are scared to use those kind of technology. But nowadays, these healthcare systems, healthcare apps, healthcare telemedicines app, teleradiology app, now they are very much popular in certain age group. So gradually it will be adapted.
True. And Mr. Pramanik, you mentioned a very, very important factor, and which is kind of the baseline of the healthcare industry, and that's patience. So we all know for a fact that there is absolutely a high amount of pressure on the healthcare industry to kind of ensure that the sensitive personal and health information is protected, and the access to this health data is limited only and only to authorized personnel. So, are you confident that your remote support software, if there is any, keeps your data secure, and if also if that particular platform or that solution is compliant with HIPAA, GSPR, PII, or PHI?
Yeah, definitely. That's the basic thumb rule for adopting any technology for a big enterprise like Manipal. Okay, we have to follow the different standards, and when we are selecting any product from the market, from the IT industry, we always go through all those standards that they are placed or not properly. Like there are different standards available in the market, like PCI, PI, and GDPR by HIPAA compliance. Uh, they have different kind of protocols to follow the data security and data privacy, right? And definitely, when we are choosing any applications, the applications, if it is like a consumer faced applications, yeah, it's from our out of the network, the consumer will be accessing. Then we have to follow the cyber security also along with these compliances. So basically, we have to follow these compliances.
True, very true, because ultimately all solutions they have to abide by the compliance that requirements of that particular industry only, and only then we can actually confirm the security aspect. So, now we're talking about security. So, Natasha, my question to you, we all know that security is always a top priority in the organization. So, what do you think is, or probably what are the standards by which an IT tool should actually adhere to, an IT support tool to be precise?
Yeah. I think, see, I'm speaking from the perspective of remote support, IT support for within a healthcare environment. What does that look like, right? So let's break that down first. So we've got the support for your healthcare practitioners' machines, right? You've got your nurses, your doctors, your physicians, and all of them. They've got their desktops, their laptops, their machines that they use for their daily work, right? Which they have in their clinics, in their offices, in their, right? So that's one thing. Then you've got the support for machines that are tied to your healthcare monitoring devices, right? Like your CT scanning, your MRI scanning, and all of these. You have machines which are tied to them, which gets that data, makes that data visible, makes it that data readable, which have operating systems on them, right? So those devices. So support for these devices across a healthcare setup needs to be available remotely as well as in person on-prem, right? I know it cannot be healthcare setups cannot be completely virtual or remote. We don't they that the luxury of that is not available because everything happens in in a hospital, in a clinic, in a healthcare setup, right? Patients come over. Uh, like Shuvankar said, during the whole pandemic, everything became some of that healthcare became remote, right? Where with the adoption of telemedicine and with the adoption of virtual appointments and virtual diagnostics and all of that, right? So while some of that is remote, a bulk of it is still in person, right? And so supporting the physicians, nurses, doctors, machines, while they are physically present in the healthcare environment, the support can still be available virtually, right? While you do have a few IT technicians which are available in these setups, a lot of that can still be done virtually with the right technology, right? And I think one of the major reasons why that has not been adopted to the extent it should be is because of security, right? Because in for every other industry, I think data security, data sensitivity is a check in the box. It is necessary, but for the healthcare, it's totally non-negotiable, right? It is the number one standard that they have to look for or adhere to before they can even look at any technology, any solutions, right? So remote support technology needs to adhere to the standards of a hospital, of a healthcare setup versus have their own standards and the hospital has to adhere to the remote support standards, right? It should not be the other way around. It has to be that it needs to be built for with the compliances that the healthcare industry needs to be compliant by. That is your PII, your GSPR, and all of these other, like Shuvankar said. For it's a no-brainer. It's completely everybody knows that for the healthcare industry, compliance is number one, data security is number one, right? That's a no-brainer. But remote support, so all remote support technology has to keep that into consideration. If they are not, then I think they need to start considering that. But we've built our remote support technology with all of the compliances in place, right, for the healthcare industry. That is your HIPAA, GSPR, PII, and all of that. But beyond that, what are the controls that you give to the IT administrators within a healthcare setup, right? They need to be able to control what their agents can do on a physician system. To what extent can they access that system? Obviously, they have to remotely control that machine to provide support, but to what extent, right? So monitoring that control and tightly winding that control to only what they should be able to do and not be able to do is just extremely essential, right? Because what agents can do on those machines can make or break your hospital's compliance, right? If they access a little more than they should, it could become like it can be that they gain access to customer data, patient data, which we don't want to allow, right? So the remote support technology should have those restrictions in place to control what an agent can do, for example, and as well as to go beyond that, right? To set up additional layers of security for that hospital. For example, a single sign-on, enabling that, right? Setting up password policies, setting up multi-factor authentication. All of that should be able to be done, as well as your reporting and your recordings should be in place, right? For keeping that hospital completely accountable for everything that happens on that system, right? Which is from the time that that agent accesses that machine. What did he click on? What did he say to the physician? What data did he access? Right? What did he solve on that machine? So every activity needs to be tracked. needs to be recorded and needs to be logged for the IT administrators' use in that hospital, right? Because tomorrow, if there is something that they need to refer back to for, to in terms of history of of system management, as well as in case of any IT security, vulnerability which is identified, they need to be able to trace back to what happened, right? So everything needs to be logged to the second of, when it's happening. And so that, I think, from a security standpoint, that's three things to summarize. One is your compliance, which is your basic level. Second is giving those controls to the IT administrator to manage and to monitor what the agents are doing on the systems. And third, it is providing additional levels of security for your agents when they are accessing those machines for their identity management, like your single sign-on, multi-factor authentication, etc.
Great. And I think when we actually say the access to data, particularly from the point of view, restriction as to how much data can be accessed by what personnel, it really matters because ultimately it's those are critical and sensitive pieces of information that should not be accessed by anyone and everyone. So really very important there. And so on that note, Mr. Pramanik, just want to know that as Natasha also mentioned, that a lot of people when they work remotely. And in case of hospitals, you might not have a lot of staff working remotely, but we all know from the perspective that, the users, as you said, the users are the consumers here in this industry. So when you have the patients accessing uh, the virtual appointment apps or maybe, the telemedicine app or something like this. So we know that the overall organization's productivity could suffer if there is lack of technical assistance while operating from a distant location, be it the hospital employees or it could be the consumers. So how have you been managing that? And how technology has actually helped you in managing such remote work scenarios? So if you could throw some light on that, please.
Yeah, sure. Sure. Already Natasha mentioned the basic steps we need to take on any kind of remote applications when we are providing this facility to the consumers, right? And in healthcare industry, particularly, patients is not having their Manipal's data. They are uploading their own personal data even also. So even like multi-hospital chain like Manipal, yeah, different there are number of hospital chains are there where patients generally go from one unit to other unit also. So cross-referral things when doctors and patients data, suppose it's defined by two entity, one is consultant and another is patients, and there is a third entity when they want to access those data, right? So there is a cross referral consultations, a cross referral accessibility of the data also there in the scenario. So, like Natasha already mentioned, there are the basic steps we need to take care, right? When we are extending any web-based application, particularly, that should have multi-factor authentication should be there, and there is a very basic concepts of your blockchain technology also, where you can define your data to whom you are giving the access, right? So, like you are traveling internationally, your data should, your Manipal data should be given access by your any third entity also, not within the Manipal organizations, maybe the outside the organizations also. So these concepts is coming. Like there are a lot of breaches in Indian healthcare industry we have seen, and it's not like out of India there are hospitals who are very disciplined way and they're maintaining data properly. Like if you are going for any medicines in outside any medical shop available nearby, so you are exposing your prescriptions to them also. You are totally given your own data to them. It's open, it's available in the market. Unlikely in outside in India, you can't take medicines until unless there is a GP reference, yeah, any your healthcare insurance reference is there. That means those data is traveling within the network. It's not going outside the network somehow. They are protecting their data. But in the Indian healthcare industry, it's very challenging. I know someone is consulting in Manipal hospitals, and they are going outside and they are giving the same prescriptions to the outside vendor, outside shop also. So I mean to say that we are trying to build cybersecurity within our system. Still, there are a lot of things to do, and within the systems, definitely what Natasha mentioned, that the basic steps like multi-factor authentications is there, enabling strong spam filters to prevent phishing those data, right? And implementing a kind of user training program. You have to transfer your knowledge to the consumer also, what they are doing. So that is a big things in healthcare industry. We are just providing service, but we have to transfer technical knowledge to them also, what their data mean to be, right? So even your in-house setup, like your filtering network traffic is a big thing. Updating software, including your OS, operating systems, applications, firmware. These are the basic things we need to follow, at least as of now, within the Manipal framework, right? I can't handle as of now the outside Manipal framework, what is going outside our network. So we are expecting that there will be a data protection law will coming from the Indian government, where we can protect at least the all the healthcare industry who are running the business in India. They will be protecting patient data.
True, true. I think from the data perspective, you have mentioned a couple of very key points, Mr. Pramanik, that ultimately it's when it's offline, the data is exposed with via our prescriptions and because it's an offline mode. But until and unless when it is online, definitely until and unless there is no there's no approval or there is no backend mechanism to track that, I think then the restriction comes into place, which kind of helps also in protecting the data and the information. So coming back to you, Natasha, although you kind of covered these pieces in the previous answer, what could be the top priorities when considering remote solutions? Now you've mentioned points like the compliance piece, data visibility, etc., and also the multi-factor authentication. Anything that you'd like to add besides those?
Yeah, I think I've spoken enough about security. That is the first number one priority, right? It cannot go, nothing else can be the first priority beyond that. But the second, I think, would be maintaining uptime, right? Because we're talking about hypersensitive care, right? We're talking about it can make or break a patient's, how they feel. Patients are the number one priority for a hospital, for a healthcare setup, right? So giving them that optimum care as fast as possible is important. And your technology plays a part in that, right? Because enabling that care, whether that physician is able to access his machine, to access the patient records, the physician is able to get access to that, either to the electronic medical records, for example, or to be able to, these machines are tied to larger monitoring machines, right? Like your scanning and all of that, right? So for these devices to remain up and running 24/7 is extremely important. And I think your remote support technology plays a part in that, because it helps to support, to monitor these machines. Like you have your remote monitoring and management, you have your ITSM technology, which we provide to be able to sit on those machines to monitor for potential issues, potential downtime, to prevent downtime, keep them up and running, prevent any security risks, keep it up and running, run virus scans on that environment. Also, in terms of if the CPU utilization, for example, is going beyond a certain capacity, make sure it is maintained at a certain level so that there is no restart or shutdowns that need to happen during the on the online hours, right? When the machine needs to stay online. Maintaining, in terms of providing onboarding for system applications, right? When there are new staff which is hired in the hospital, or for staff that is working in different shifts, right? And when they come into a new shift and they need to use some new software, providing that remote support and that accessibility to that technology by having IT agents standing by to provide that support on those applications in case the new staff that are new to those applications need help, right? Because when somebody is new to software, using new software, they would need some hand holding, right? Because not all of us are extremely tech savvy in that front, and especially in a hospital, they are clinically trained, but they are not technologically, 100% or tech experts on that level. So having tech experts, IT experts sitting, standing by to provide that support, right? So your as much as the hospital needs to be up and running, providing optimum care to their patients, technology needs to be up and running and providing that support to the physicians and to the hospital to provide that care, right? So remote support technology plays a very big part of that, in working in the background behind the scenes to provide that optimum, uptime of those devices.
Couldn't agree more on the uptime piece because you have everything in place. You have the security, you have all the other restrictions and all the other security pieces in place. But if the platform or the solution is not up and running, it really doesn't make sense. So uptime really really important out there. So with that, we have reached the end of our session. And Mr. Shuvankar, any last thoughts or best practices that you would like to share for our viewers?
And like Natasha already mentioned, that definitely the top priority next 1 to 2 years will be cybersecurity. Now we are exposing too much. Patient healthcare data is exposing too much, and as I mentioned in earlier, also like Indian healthcare industry is more vulnerable. It's not very disciplined in nature. So when you are exploring in some this kind of it's a kind of Ukraine and Russia war. You are exploring somewhere no one can be controlled. So in that scenario, cybersecurity is the topmost priority for healthcare industry. And secondly, I am personally expecting that sensor-based technology which are coming, and obviously remote-based technology. These two area must reach the accuracy level at optimum, because still in healthcare industry these two things are not optimum in terms of accuracy, right? So that need to be more. I am expecting that from next 1 to 2 years that it should be matured enough in that.
Great. Natasha, coming to you, anything that you would like to add for our viewers? Any best practices from your end?
Yeah, I think I've pretty much mentioned, the bare necessities, which is your security, uptime, and all of that, right? It's a no-brainer. I think technology experts like Shuvankar would have already be, these are things that he thinks about, like when that's the foundational layer that he would have thought about, right? But I think if you want to excel, if you want to go beyond, in terms of establishing a brand for yourselves in terms of the technology adoption and innovation that you have within your hospital. I think you look beyond the basic technology. You look at some advanced levels of technology as well. Like we have a product called as Live Lens, right, which is a visual engagement solution for IT agents and end users, which in a hospital setup could be your physicians or your nurses or your practitioners that are using clinical devices for the first time, or when there are issues on a device, which is not software dependent or software. It cannot be remotely controlled to be troubleshooted, right? They use our live lens tool to visually show what's happening to the IT agent that could be sitting. It could be the engineer of, who provided that hardware, right? It could be the supplier. It could be the engineer from that particular manufacturing company that has provided that hardware, right? They're sitting on the other end to see what is happening on that machine and to provide some resolution, provide some troubleshooting, right? Because oftentimes, we cannot have your field engineers coming from one location to the other every time there is an issue, right? It takes time, it takes money, as well as it costs the hospital time because that patient care is being delayed, right? So think innovatively, think beyond your basic. I think like Shuvankar rightly said, sensor technology, which is coming up, your remote support technology, all of that supports innovation. But yeah, think beyond when it comes to patient care.
Great. Thank you so much for the inputs that both of you have shared. I think they're really going to add value from our viewer perspective also. With that, we conclude our session. Thank you, Mr. Pramanik. Thanks, Natasha.
Thank you. Thank you.
Thank you so much. It's been a pleasure.